and welcome to our pediatric demonstration. We are going to go over med preparation a little bit. We've noticed over the quarters that there are some things that are lost or dropped off, or perhaps you have not really been shown the appropriate way to do things. So we want to go over a couple of things that are involved with drawing up medications and giving medications. We're going to start with oral medication, which you do a lot in pediatrics. We won't do so many in the simulation, but there are a few times when you'll be drawing it up. We're going to use our example of ibuprofen. Now, it is liquid. A lot of pediatric liquid or medications are in liquid form. The dropper is marked, and it is it'll show you here on the markers how much you have, but this is for home use only. We don't use a dropper as a measurement in a hospital situation. So we want to use exactly the right amount, and you would figure out your dose and use an oral syringe. The oral syringes, I'll show you on this one, a lot of them are amber color, this color, and they have a very smooth tip. They also make oral syringes that families can buy at a pharmacy that have kind of a wide curved tip so that it can be directed into the buccal cavity of the baby's mouth. You can use these to drop your medication. It is marked appropriately. On the side of the syringe it says for oral use only. It does not have any lines. It's not a Lorlock. If you pick up a syringe like this, it's got a smooth tip. It's an oral syringe. It is not intended for IV use. Another option for families, but not in a hospital situation, is the marked cup, medication cup. You can, if the child wants to drink it out of a little cup, that's fine. Draw it up with your syringe and squirt it into the cup. Don't just pour it into the cup. Again, that would be acceptable for home use. In a hospital situation, you should always be very careful about measuring your pediatric medications. Now, we have a series of different sizes of syringes here. We've got a 10 ml, some 5 mLs, 3 mLs, and I had a 1 ml here, yeah. I think of syringes as being like measuring cups. Think about exactly how much medication you need to draw up. If you're going to be diluting it further, which we do often do in pediatric medications, have a syringe that is going to hold the volume that you need to inject. However, if you need to dilute a medication to quite a large amount, don't grab that 20 ml syringe and try to draw up a medication with it. You can use 3 syringes. That's perfectly fine to do. You can take a 3 ml syringe and open it, draw up your 2.5 mLs, transfer it into a larger syringe, attach your flush, or your normal saline, what you're going to dilute it with, attach that to your larger syringe, and put in exactly the correct amount. And we're going to go over how to do that with a transfer device in a few minutes. When you're opening syringes and needles, they are designed to be opened in a specific way. Here are some needles. These are the safety end ones. I've got some here that do not, these are really old. They are not safety needles. I'm going to be using these just to demonstrate how these are packaged and to kind of help us get rid of them because we don't use them in lab anymore. Needles and syringes are packaged so that the area that you open, the paper is going to be a little bit longer, and the paper is separated at the top. That is where you should be opening your package. For the needle, here is where you should be opening your package. On the needle, it's going to be on the hub side. On the syringe, it's going to be on the plunger side. It's designed that way because you open your syringe like this, get that open, lay it down. You keep that end in the packet. It's sterile. It should stay sterile. You open your needle, you keep your fingers away from that end, you hold the needle with the package, pull your syringe out, and attach it. You have not touched anything here. The end of the syringe needs to stay sterile. That means that we want you to prioritize putting a needle in a sharps container, but not at the expense of contamination. So you don't take the needle off after you draw and then just set your syringe down. That's contamination. You need to keep that syringe covered. It is fine to keep a capped needle on your syringe and walk across the room. You can do that. Another option is, if you really don't want to have that needle around your patient at all, you can take it off. You can put a cap on. Now these also come sterilely packaged. So you would open the little package in the same way that I just opened, got it the wrong direction here. You would open it the same way that you open your needle or your syringe. You don't touch that end. Take your needle off, cap it, and then you can put your needle in the sharps container. That priority is up to you at what point you want to get rid of that needle, but the syringe has got to stay covered. For covering your needles for recapping, you've been taught that, that you don't recap your needles. That is true if you have used your needle on a patient. So let's say you just did an IM injection and you've done your injection and you come out. Now you want to get rid of this right away. So you would put that directly in the sharps container. But if your situation is that you have just pulled up some medication and this has not touched a patient, then you need to recap your needle if you need to have that syringe covered. It's perfectly fine to recap your needle as long as it has not been used on a patient. So you do your swoop, be very careful not to touch the counter, and then tighten that cap with your other hand down at the base of the cap. Don't push a needle cap on this way. I've seen the needle go through the end of the cap and stick people. So that's not good. You really want to hold it by the base and do that. Okay, so we can set that aside. Transferring medications. Let's say we want to draw up 1.5 mLs of my medication here, but it needs to be diluted in an additional 4 mLs to make their concentration safe. So I want to end up with a 10 ml syringe. Here's my 10 ml syringe. I'm going to have my final concentration in here. I can open this and have it ready if I want, if I've got everything in place and together. I want to use my blunt needle to draw up my medication. I have a medication here that is a multi-dose vial. So the cap is off of it. It has been used before. I am definitely going to want to alcohol this off. So I would do that too. You all know the drill. 10 to 30 or 15 to 30 seconds. Oh, I almost made that mistake. 15 to 30 seconds. Now, if I'm drawing up, now I don't remember what I said, 1.5 mLs, I want to use an appropriate size syringe to draw this up. It doesn't make sense to try to draw up 1.5 mLs in a 10 ml syringe, or a larger syringe for that matter if I need my dilution to be larger. These increments on this syringe are in 0.2. I can't accurately pull up 1.5 mLs in this syringe. So I think I will use a 3 ml syringe. That is the best size. Syringes are like measuring cups. Use the correct size to get the volume that you want. That's all these are. So now I've pulled out this syringe. I'm maintaining that end sterilely. I'm not setting the syringe down anywhere. If I had to set down this syringe, if I really had to, I could open up the original package and slip it back in. That's still sterile. I'm going to open that into the needle, pull this out, and attach them. I have now alcoholed off my vial. I'm going to pull off my needle. I'm going to flare. I want 1.5 mLs of air. I'm going to go straight down. I want to inject the air above the level of the fluid. I don't want to cause bubbles down there, so I want the tip of my needle above the level of the fluid. Inject my air, turn it upside down. If this is correctly equalized with air and fluid, I don't even have to draw on the plunger. It should be just pulling up that medication because it's displacing the air that I put in there. So it's not quite there, but it's close. All right. I can draw up a little bit more just because I've got an air bubble, so I can even that out. Okay, so now I've got my 1.5 mLs. I'm going to take that out. I'm going to recap my needle because I want to keep the end of this syringe sterile and covered. Now I can open my, or get my 10 ml syringe out or ready. That's ready. I've got a transfer device here. This opens from here. On the transfer device, there are 2 sterile caps on the end. So I can take one cap off of it at a time. When I'm pulling this cap off, I keep the inside edges untouched. That's what keeps them sterile. So I unscrew that. I can take the needle off of this. No touching. Put that on there. This has got a sterile cap on it. And take out my 10 ml syringe because this is my end syringe that I want everything to end up in. I don't have to open up this plunger or anything. Now I can just unscrew this end. This end is sterile. Put my 2 sterile ends together. And I can just push that in. So that's done. I'm going to set this down for a minute if I need to. Both ends are still sterile. I can set that down. They're capped. Now I'm going to take my normal saline. I can now unhook this. Take my sterile cap off of the normal saline. Oh, I goofed. You didn't see me do that. Okay. I'm going to leave a little pause here for editing purposes. So I'm going to pick this up. Both ends are still sterile. I want to take off my empty syringe and I'm going to put my normal saline on that end now. And now I've got about 9.5 mLs in there, or I can also measure it on here. If I want a total of 6 mLs, I can just add that normal saline so that I have 6 mLs of medication. Something precipitated in there. That's interesting. So I definitely would not give this. I'd be calling the pharmacy. So now I can take this off. I can, if I have a new needle, I can put a new needle on. If I can, but I can't, now that I've put this needle down, I can't use this again. I've contaminated the end of that needle. So I would open up a sterilely packaged cap, and haven't touched that, and put that over my syringe so that I can carry this to the bedside and give it IV. The ends of everything have to stay sterile. And I know that when you come into SimLab, everything has been used multiple times. And you won't really have too much opportunity to be opening new syringes, new needles, and be putting them together. But when you do have that opportunity, be aware, be conscientious of the way you are opening your equipment. They are designed to open with the appropriate end and put them together easily and swiftly and sterilely. So all these ends need to stay sterile. I have on occasion seen students come in and they will pick up something and they know the end should be clean, and they'll pick it up and take an alcohol swab and swab it off. That will not sterilize anything. The only purpose of alcohol is to clean something that has been exposed and cannot be handled in a sterile way. So the surface of your skin is not sterile. You're using an alcohol pad to try to clean off as much as we can, and that's fine. When we're using a multi-dose vial, this rubber is exposed. So we're just taking an alcohol swab, we're cleaning that off as best we can. It's not sterilizing it. It's cleaning it off in the best manner possible. If you have an end of something, a syringe, a tubing, that is sterile and you have to disconnect it, you need to have some kind of a sterile cap that you can put on there to keep it sterile. Taking an alcohol swab and swabbing off the end of a tube is not sterile, and it's not something that you want to do. Okay, let's go on to IV tubing, IV bags. Here again, we want to keep things sterile. IV bags come with these two ends. This is the end that you're going to connect your tubing to, you know that. In pediatric sims, we do access this end. This is the injectable port. And we don't add medications to a bag, but you may have a bag of normal saline available to you if you need to dilute your medication to 30 or 40 mLs, and you will have instances in pediatrics where you're going to be diluting your medications that way. Rather than trying to use 4 or 5 flushes, we want you to just draw your medication or draw your volume from a normal saline bag. And you can do that by using a blunt needle and using this port. You just alcohol it off. This is an exposed end, not sterilely covered, so you're going to alcohol it off as best you can. Then you use your syringe with a blunt needle. You can insert it here, and then you can draw your normal saline into your syringe from there. I'm going to back up a second. Something that I want to say about our flush syringes: do not add medications to a flush syringe. This syringe is already marked. It is marked as being normal saline. You can't just put an additional label over it and say, oh, now it's got medication in it. It is labeled. So don't ever add a medication to a normal saline syringe. Just use a third syringe and put your medication, your normal saline, in a third syringe. Mark that syringe appropriately. When we open IV tubing, here again, you very often in SimLab, you're reusing the tubing and you don't have the opportunity to see that many sterilely packaged packets. But when you really open IV tubing, this spike that goes into the bag has a cap on it to keep this tip sterile. That is the whole idea. So now I have my IV bag and I have my IV tubing. I've loosened up my cap a little bit because I'm holding these with 2 different hands and I've got to be able to manipulate this. This will come off. This, I need to pull that cap off without contaminating anything, and then insert this. This stays sterile. This whole spike needs to stay sterile. When you are changing an IV bag, you cannot take the spike out and just hang it on the IV hook on the pump. The end has to stay sterile. So that means if you are in a position where you are switching out IV bags, now you've got to be really prepared. You've got your IV bag hanging with your spike in it. You've got another bag that you're going to switch out. You need to have caps and plugs loosened just a little bit so that you can, you've got your new bag. It's got a little bit of a loosened cap, but it's on. It's keeping that end sterile. Then you've got to pull this spike out of the old bag, and then take your new bag and spike that bag right away. You don't have time. You don't have the convenience of just hanging this someplace and then going and getting a new bag. Everything has to be ready to go. These ends have to stay sterile. Once it's contaminated, it needs to be completely changed out. Hello? This is a short video on how to set up our nebulizer in the pediatric room. This is our pediatric nebulizer mask. I've heard it called many things. You can decide what this animal is. Cute though. When we're giving a nebulizer, the medication is a liquid medication, and it will go into the chamber of this mask. So get our medication. This unscrews right here. It's a very simple mechanism. You put your medication into the little cup. Screw this back on. The way this works is that forced air or oxygen comes up through the tube, moves through the medication, and aerosolizes it. Then it goes into the mask, and the patient breathes through the mask. That means that this needs to be upright all the time in order for the air to go through that medication. If the patient's lying down, it will not go through the medication. So the patient needs to be sitting up. On a child, we can have them sitting up. Our mannequin will sit up all the way. So you can sit the child up as far as you would like to. With the baby, we would have the parent hold them up at a 45-degree angle or higher if we can get them that high, to have this as straight as possible. This is a high flow device. That means that the air moving through here has to be at a pretty high flow rate. It should be at least 10. The way our wall mount works, you don't want to put it any higher than 8 or else this will pop off. It's just the way our system is. So in reality, don't put it any higher than 8 in here in the sim lab. But in real life, you would have it at least the flow rate to 10. So because this is a high flow device, we're going to connect it to this flow meter here. So here's our flow meter that does not have any humidification on it, and this is where we would hook up our nebulizer mask. And then, having the child sitting straight up, we would put the mask on them and put that around their head and let that nebulize. So when it does nebulize correctly, when the flow is high enough, you will see mist coming out of the mask. So the way you know that it's finished is you keep checking the amount of fluid that's left in the chamber. Sometimes we'll just give it a tap to get things nebulizing again. If the mist has slowed down but there's still fluid in here, we'll just come and tap it a bit, and it'll eventually all mist out. The amount of time it takes to do this is dependent on the flow rate. So the higher the flow rate, the faster this is going to go. But we do want the entire chamber to be empty when we stop. And then we just dismantle this, take this off, and hopefully we have some good results from our medication. The medications that are given through a nebulizer tend to be medications that we should see a fairly quick result from. You do need to do pre-assessment with these medications, particularly albuterol. You want to pre-assess by listening to the lungs, having a good sense of that. Then after the treatment is done, after 20-30 minutes, you want to do a post-assessment and see if the patient sounds better. For all medications, for any medication, whether it's IV, IM, nebulizer, PO, if you have a pre-assessment to do with that medication, you do the pre-assessment, you give the medication, you do all of your med checks, you do the post-assessment. You can't delegate any piece of that out to anyone else. If you're going to give a medication, you own every aspect of it from start to finish. It's your charting, it's your observation, it's your assessment. You own it. That's true of IV medications as well, even normal saline. If you're just hanging a bag of normal saline, you do not ask somebody else to spike that bag for you. You are responsible for the med check. All IV medications, all IV fluids are medications. So you go through a med check just like you would for any medication. Make sure that you are hanging the right bag. Make sure that you're hanging the right fluid. And then you spike that bag, you hang it, you prime the tubing, you hook it up, and you do any pre and post assessment. So I think that concludes my little medication demonstration, and I hope it was useful. I hope you got some clarification from that, and we look forward to seeing you in SimLab.